I'm Neil Anderson. I'm an outpatient therapist, and this is the Comprehensive Healthcare Employee Spotlight video. My typical day here does vary some, but it almost always entails 6 to 8 clients, but in addition to that, paperwork, documenting the work that I've done with clients. And at least a couple of 3 days a week we'll have some kind of meetings, various meetings to attend. That's kind of the typical day. This role can be challenging in that, of course, we're working with many different types of clients with many different types of problems, some of them very difficult to deal with. So it does take a great deal of patience and a great deal of perseverance, but the end result is really worth it. But it can be challenging at times. To be successful in this particular job or role definitely requires, first of all, the education, to the background, the information about the psychological systems, social systems, but also really important to have empathy and flexibility and patience. Those things kind of all together. That's really what you need. You know, there are 2 things that I think are my favorite aspects of working here. One, of course, is when you make positive progress with clients. Those are always extremely satisfying experiences. It really makes this work worth it. But in addition to that, working with other professionals is a great joy. The team that I'm on, we have a great time together. We enjoy each other's company in meetings. We have a lot of laughter, and that helps to sort of make the whole experience much more enjoyable. Our agency is very supportive in terms of providing training, very comprehensive training in evidence-based practices. There's more training than I've ever experienced in any position I've been before, and they're very supportive of anything that you might be interested in learning about. They're going to try to find a way to, if that works with what you're working on and what kind of clients you're working with, they're going to be interested in trying to find that for you. And that's been a wonderful experience for me. To get into a position here, of course, you first have to have the education requirements for the position. And if you're working on that, I think focusing on what kinds of difficulties, challenges exist in community mental health, understanding the different makeup of clientele that we might work with here, and just really trying to keep focused on the goals that you have in your life, and trying to understand different people's perspectives and different lifestyles, different kinds of experiences that people have had, and how that leads them to where they are now, both the good and the difficult things about their lives.